So welcome everybody to our webinar to launch Mapping Rare, a World of Advocacy. And thank you for joining us today as we shine a light on the achievements of our members around the world. I'll start by introducing myself. My name is Deborah Bellin. I'm the Strategic Engagement Manager here at Rare Diseases International. And part of my role is to be a bridge between our members and RDI as an organization. And so I'm really excited to be sharing this project with you and sharing the achievements of our members, which I'm sure you're going to find really inspiring. So before we get started, I just wanted to give you a few helpful tips for this webinar. So we are using a webinar format because we're expecting quite a few people today. And so we still want you to participate as much as possible. But if you would like to ask a question, please use the Q&A box, and we will get to those questions towards the end of the webinar. But if you have any comments, you can use the chat box at any time to type those in. And we have enabled captioning if you need it. So feel free to turn those on. They're at the bottom underneath the screen. And so it's now my pleasure to, well, actually, before I introduce our first speaker, let me go through our agenda. I'm going to first be introducing our CEO, Alexandra Humbert-Perry, and that will be followed by opening remarks from our chair, Durhan Wang-Rieger. And then we will have a few keynote speakers. So the first keynote address will be from Dr. Roberto Giugliani, who's a professor of genetics at the Federal University of Rio Grande do Sul and co-founder of Casa dos Raros in Brazil. And then we will have another keynote address from Dr. Rüdiger Krech, who's the director of health promotion at the World Health Organization. And our last keynote speaker will be Dr. Shinya Imura of the IFPMA Industry Coordination Group on Rare Diseases. After that, we will be introducing our panelists, who are the first 13 participants of Mapping Rare. And they'll be talking to you about their projects. And then we'll open up the floor for questions during the Q&A segment. So without further ado, I'd like to introduce our CEO, Alexandra Humbert-Perry, for her opening remarks.
Thank you, Deborah. Well, it's a pleasure for me to welcome you all. I heard that we had 300 participants and also this key panelist speakers on the occasion of Rare Disease Day. I think it's really make us so optimistic and encouraged by this attendance. So just to remind who is Rare Disease International, in case you don't know, we are the global alliance representing more than 300 million persons living with rare diseases. And our main mission is to be a strong voice of persons living with rare diseases. But not only, I think RDI has the duty to gather evidence knowledge and also data. And this is the spirit of this initiative that we launched today, Mapping Rare, a World of Advocacy. We want to show that our members are really driving the change at their level, at local, national, regional levels. So the initiative is starting with 12 cases, but it will grow through the years and years. This is important actually because it showed the readiness, the community, and not only the patient organization, but the community overall of the rare disease, the private sector, the public sector. If we remind the high-level commitment we had during the UN high-level meeting on universal health coverage, not in September, not very far away, to show that everyone is ready. So what is missing really? We need just to take the extra level. So we are all working, and we will continue to work with all our partners, including the World Health Organization, to develop a global framework for action, to leverage what is already happening. So I'm going to stop here, and I'm eager to hear our members presenting their success over the year. And I have also the pleasure to now give the floor to Duran, the chair of Rare Diseases International. And it's been 2 very intense days in Canada, where she is the president and CEO of the Canadian Organization for Rare Diseases. So please, Duran, it's yours.
Thank you so very much. I can't tell you how excited I am to be here, to see certainly all the panelists that are going to be speaking. I had a chance yesterday, after our 2 intense days of rare diseases here in Canada, to go through all of the presentation. So this is absolutely a world-class opportunity. Really huge thanks. I think this is the first time the whole staff has been able to participate in pulling together this event. So maybe this is a bit great opportunity as our flagship event for Rare Disease Day. As all of you, I am sure February the 29th is a very, very special day. We only get it once every 4 years. So we probably won't wait another 4 years to do this, but this is indeed a very special occasion. Alex was right. We had an amazing 2 days here in Canada. And I think for most of you, from what I could tell, also had amazing rare disease celebrations, advances in what you were doing in your own country. I had an opportunity to participate a bit in February in a number of other activities. So I am so looking forward to this. I want to give a huge shout out to all the people who submitted. As I say, it is amazing what we're doing as a community, what we're able to share in terms of what others can learn from. And importantly, I think it really shows what Rare Diseases International is. I've been here since the beginning, and I can tell you that I had not even an inkling that we could be where we are here today. Not only have we been able to really build on the collaborations we've got, the international collaborations, the global collaborations, but the most exciting is we've seen so many groups come in at a national level, but even be within that national level, so many groups that have taken power. So I think we're well on our way to really what, as Alex says, was the mission of Rare Diseases International, and that is to make sure that everybody who's living with a rare disease has an opportunity to live their full potential. And we are doing that really by the work that we're doing on the ground in our international groups, but again, working on the ground and certainly in our national alliances. And now I'm just so very proud to see the growth of the regional alliances. I think that was, what we always talked about as to the way in which RDI can work. And today, really, I cannot believe that we're actually getting to date right now. I would have thought it would have taken us another 4 years to get to this point. So kudos to everyone. And I'm so very excited as well that I will be able to share what we're doing in Canada. So thank you again very much to Alex, to the entire team that's there, and for the opportunity to welcome everybody.
Thank you very much, Johan. I would now like to introduce our keynote speakers. The first speaker is Dr. Roberto Giugliani. Dr. Giugliani is an expert geneticist and an internationally renowned researcher on rare diseases. He's based at the Federal University of Rio Grande do Sul in Brazil, and he's also a co-founder of Casa dos Raros, which will be presented later in this webinar.
Thank you. Thank you. Congratulations for organizing this webinar in this very busy week. I wish to report an innovative experience we are having in Brazil at Casa dos Raros, a house of rares. It's a non-profit charity organization established as a joint venture between an advocacy group, Casa Hunter, and an academic initiative, Genetics for our Institute. So our aims are to shorten the patient journey from the onset of manifestations to the diagnosis and to enable appropriate management near to patient's home. Currently, average time from onset of symptoms to diagnosis in Brazil is around 5 years. And it's common that the patient waits for 2 years for the first consultation at a reference service. And just at this first consultation that the team will become aware of the situation and start to plan the investigation. So according to our operational models, patients from anywhere in Brazil accesses our website and place a statement of interest to start the process. And soon thereafter, our social worker will contact the family to perform a first screening and to map the situation. So the request is now enriched with a few more details, is taken to the clinical team, and a telemedicine consultation is scheduled to obtain data on medical history, family history, results of previous investigations. On this telemedicine approach, health professionals who already evaluated the case before can also be contacted. So after a series of teleconsultations, an in-person visit to Casa dos Raros is scheduled, and the appropriate team for that specific case will be available for the evaluation. For instance, that case needs a geneticist, a cardiologist, or a neurologist, or a physical therapist. They will be there to evaluate the case. Also, the procedures needed for the investigation will be scheduled at the same time, like imaging, collection of blood for genetic tests, and so on. So combining the data of medical history, multi-professional evaluation, and test results, the team will be, in most cases, able to reach a diagnosis shortly thereafter. So after the diagnosis, a management plan is established, and the local healthcare team is contacted to execute this plan. And whenever needed, the appropriate training for the local healthcare team is also provided. So because this Casa dos Raros is the name is Center for Integral Attention and Training in Rare Disease. And we, of course, will perform a long-term follow-up to each case to confirm that the plan is being fully executed, and also that if you need to update or change the plan due to new achievements, we will do. So this is in summary is what we are doing in Brazil. Thank you.
Thank you very much, Dr. Giugliani. And now I'm very happy to introduce our next keynote speaker, who is Dr. Roberto Giugliani of the World Health Organization, where he is Director of Health Promotion. Dr. Giugliani has supported the rare disease community at the global level since the beginning of the collaboration between RDI and the WHO, and so we're very pleased to have him here today.
Thank you so much, Deborah, and a very warm welcome to all of you. Dear Alexandra, dear Durhan, friends, I see Jan Paola online as well, so it's really a pleasure for me to be with you today. And why is it so important that we as WHO are strongly behind the rare disease agenda and help whatever we can to mitigate the problems that we're facing? So while I completely agree with you, Durhan, it's a moment for celebration. Happy Rare Disease Day, because again, I do agree that we are somewhere different today than we were a couple of years ago. And that has to do with also the WHO's agenda on universal health coverage. This is one of the big goals that member states have all aligned and agreed to. That means that by 2030, we want actually everyone to be safeguarded from financial shocks when he or she needs medical care and social care. And so everyone everywhere should receive the services they need without facing these financial hardships. Now, we have made some progress in the past 5 years on that UHC agenda. We have actually an additional about 700 million people that today enjoy that coverage. However, there's a long way to go to reach the goal that we have been setting through the Sustainable Development Goals. And there comes in all these 300 million people living with a rare disease. Just to give you one example, on neurological disorders, we're thinking that about half of the rare diseases are neurological or have neurological consequences. Now, there is a limited number of health workers with neurology-specific training in lower resource settings. So, for example, in lower income countries, the median neurological workforce is only 1 per million population. And that shows us the need to really move the needle forward in terms of capacity, of course, on rare diseases, but also to centralize, to come together the knowledge and the experiences that we need. And here again, I think we are making good steps forward, because now with the increasing awareness, but also advocacy work that you all are doing, and we're really extremely grateful for that. A number of countries have prioritized rare diseases and improved their public health policy contexts. So an important, therefore, next step is that we facilitate the knowledge sharing at the international level. And thank you very much, Roberto, for sharing your experience from Brazil just now. We need to learn from each other and which policies were adopted, which action plans were implemented, and which intersectoral committees were established so that people living with a rare disease have better access to diagnosis and care, but also have better financial and social support. So we need to really have that sort of knowledge sharing, not only in some of the regions of the world, but really globally. And therefore, we need more and better collaboration amongst governments if we want to improve the situation of people living with a rare disease at a large scale. One recent example of such international collaboration is the adoption in 2022 of Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorders. So this action plan from 2022 to 2031. This action plan will provide an opportunity for countries to cooperate in order to reduce the stigma, impact, and burden of neurological conditions, and that includes the rare neurological disorders and their associated mortality, morbidity, and disability. And then in terms of ongoing work, we also need the continued support of patients, organizations, and other actors, including governments, to launch the WHO Global Network for Rare Diseases in 2024, so during this year, and to maintain it operational. So, colleagues, there is a big work agenda very concretely in front of us. We need to centralize the expertise, use technological advances as digital opportunities that we now have in order to then reduce the times for diagnosis and care, and really make the link also with clinician networks, so to enable clinicians to get up to speed with the knowledge they need on rare diseases. And with this, I hand back over to you. Thank you very much.
Thank you very much. And now I would like to introduce our next and last keynote speaker, who's Dr. Shinya Imura of the IFPMA Industry Coordination Group on Rare Diseases.
Thank you for your introduction and the opportunity to speak today. My name is Shinya, and I'm very excited and honored to represent the IFPMA Industry Working Group at this significant event. I'd like to begin by congratulating Rare Disease International and Rare Disease community for your remarkable achievement. Your advocacy is the driving force, and without your voice, none of this would be possible. Rare Disease Day is very important for everyone, including pharmaceutical industry, as it raises awareness, promote research and development, influence policy, and most importantly, connect all the stakeholders around the world as one community. Mapping Rare is a critical initiative as it facilitates shared learning globally. We will be able to learn from successful examples around the world. But what is important is that the mapping cannot be done alone. So all stakeholders, patient, family, caregiver, healthcare provider, researcher, policymaker, payer, industry, all need to share their views as a collective effort. With the mapping, we can together address a challenge such as diagnosis odyssey, drug development, and access to drug and care through multi-stakeholder dialogue. As innovative pharmaceutical industry, we are committed to the rare disease community. Our primary goal is to develop drugs and provide access to them. It is important to note that 95% of rare diseases still do not have treatment. So there's a lot more work to be done. Obviously, we cannot achieve this alone. So our commitment is a joint effort, working with you, government, and the entire community to have the right incentive for further innovation. In line with our commitment, we have been collaborating with various stakeholders to address the challenge that these patients are facing. This is translated to some key public-private partnerships with the community, such as International Rare Disease Research Consortium, Together for Rare Disease, Screening for Care, APEC Rare Disease Network, and more. I can go along. IFPMA is also ramping up rare disease engagement and has created this rare disease working group to partner with Rare Disease International, WHO, and other stakeholders to accelerate global network for rare disease and ongoing effort to a 2025 WHO resolution on rare disease. For example, at IFPMA, we are currently collaborating with Rare Disease International on global socioeconomic burden study on rare disease. One of the objectives of this project is to highlight the importance of investment in rare disease, especially in low-middle-income countries, as there are no studies on this topic. We are aiming to publish the result in the coming months, so please stay tuned. Finally, I would like to share our vision. Actually, I want to incorporate your word, rare is many, and together we are stronger. Although number of people working in the rare disease field may be small, but by coming together, share our expertise, putting our resources, and collaborating, we can achieve success and make significant progress in addressing the huge unmet needs of the rare disease community. Let's continue working together to tackle these challenges. Thank you.
Thank you very much, Shinya. And now it's time to launch the Mapping Rare website. But before I get to the site itself, I just wanted to go over the rationale behind Mapping Rare and the objectives of our project. So the first objective is to amplify the voices of persons living with rare diseases. The second is to celebrate the achievements of our members. The third is to inspire and empower the rare disease community. And I think that the achievements that you'll see highlighted today will really do that. And the fourth is to inform the wider public about rare diseases. So it's not just about our community, but about the greater community as well. So I hope that some of you have been able to see the site, but if not, you can get a glimpse of it here. I've put the URL at the top of the screen. I'll also show that at the end, and it's also linked from our website. There's a QR code as well that you can use to access it. And so you can see that our website has the globe, and on the globe, there's different markers with different achievements that you can click on. And for each one, we have a key achievement, and then why it matters, really what the impact has been of the achievement, and then very importantly also how they did it, because we think it's important for others to be able to learn from what some of those organizations have been able to do. And now I'd like to turn to our members, our participants, to ask them about their participation in Mapping Rare and their achievements. And I've divided the groups into different segments according to the theme that corresponds to their achievement. And we're going to start off with policy and advocacy. And in this category, we have two national alliances. The Canadian Organization for Rare Disorders, which created a national rare disease network, and Rare Voices Australia, which created a national rare disease action plan. Now, Rare Voices Australia couldn't be with us today due to the time difference, so they've sent us a video, which I will play for you now.
Hi, I'm Nicole from Rare Voices Australia, the national peak body for the estimated 2 million Australians who live with a rare disease. We are so pleased to be participating in this international project for Rare Disease Day. Mapping Rare. It's a great way to highlight the achievements of the rare disease community around the world. What a fantastic way for us to share learning and to learn from each other. Visit the Mapping Rare website and find out about the development of the National Strategic Action Plan for Rare Diseases in Australia. Rare Voices Australia led the collaborative development of this plan, Australia's first action plan for rare diseases. And we have been leading its implementation post-launch. The action plan has been embraced by the whole rare disease sector in Australia, and it continues to influence in so many ways. It influences medicines policy and HTA process, research, education and awareness resources, mental health support, clinical recommendation. The list goes on. The collaborative development of the action plan brought the rare disease sector together. People living with a rare disease, advocates, support groups, clinicians, researchers, governments, and the pharmaceutical industry. And this collaboration continues as we, the sector, works together towards the action plan's full implementation. Make sure you check out Mapping Rare for Rare Disease Day. Goodbye from Australia.
And so now I would like to turn to Durhan Wangmiger, who is also the president of the Canadian Organization for Rare Disorders, so that she can tell us a bit more about the Canadian Rare Disease Network. And I'd like to start off, Durhan, by just asking you, what do you expect the impact of this National Rare Disease Network to be?
Well, let me first of all kind of give real credit to our even getting a rare disease network, because it is in fact the accumulation of all that we have learned from the international community, certainly starting with Reuters and our membership in Reuters probably way back in 2006 and participating in that first International Rare Disease Day. And it was in fact our vision to actually have a national plan for rare diseases following the European model. Certainly it was our goal to actually have a rare disease network across the country. And it has indeed taken us all these years to get to it. But we do in fact have officially a rare disease network. It brings together all of the medical centers, brings together all of the agencies and organizations that are supporting rare diseases under one collective vision, certainly one shared set of plans and actions going forward. We had a fabulous 2 days in Ottawa at our national capital, where we had all sectors, including a great opportunity to visit with the parliamentarians, and had, many of them participating with us to launch the network. On top of that, of course, and very important, is launching in action the rare disease drug strategy, which I think we mentioned last year. The government launch with $1.5 billion to put together a rare disease drug plan. So it really has been, I think, an amazing opportunity to have on the ground, listening to what Roberto Giugliani was talking about, bringing together all the sectors in terms of screening, diagnosis, access to specialists, access to care, and also then the community organizations. But also then being able to make sure that part of that is going to help us get optimal access to the best medicines for rare disease patients.
So I know that this has been a really long process to develop this rare disease strategy and the rare disease network. And could you tell us, Durhan, is there anything that you would advise to other national alliances that want to go down this path?
Yeah, be prepared for for a long, long journey. I mean, I don't think we anticipated that it was going to take us. I think some 15 years to get here. It really has been. It's been a step-by-step process. Obviously, the most important is bringing together and working collectively as a community. For us, the most important thing was actually get some credibility as a patient organization. That was not easy. I mean, and we started at a time where, you know, patients were really begrudgingly even recognized. And so for me, it's been a great journey, but yes, work together, bring all your sectors together, and stay the course. You can't give up.
Great, thank you. I think that's very inspiring for other groups. So now I'd like to move on to the topic of awareness and inclusion. And we have two very different organizations in this category. The first is Fragile X International, which lobbied to have a more inclusive name for the gene that causes Fragile X. And the other is the Ali Kamara Rare Disease Foundation, which is located in Tanzania, and which fought to have access to homeschooling for children with rare diseases and complex needs that couldn't attend regular school. And I'll ask the first question to Kirsten. Could you explain a little bit about what the impact has been of this achievement, and maybe describe it a bit for those who don't know?
It's been absolutely huge, Deborah, and it's been global as well. So the Fragile X syndrome is caused when a protein isn't produced by the FMR1 gene. We all of us have the FMR1 gene, and we all have the FMRP protein. However, when Fragile X syndrome was first identified over 30 years ago, and they named the gene that we all have, they called it the Fragile X mental retardation gene. We found this as a community hugely offensive. And it meant that whenever there was a diagnosis and somebody Googled what is Fragile X, they saw the word retardation. And there was instantly this discrimination and this label put on children. And it also meant that families didn't want to tell other people what their child had, because when people looked at it, that's what they saw. They saw the negativity rather than seeing the whole person and the wonderful aspects, their sense of humor, the way they love friendship and like to be around people and sociability and all the positive aspects. They literally saw the wrong bit, that there was this word retardation. So we had a conference and we decided we needed to do something about it because we had all faced stigma in our own lives, in our own families, and amongst medical professionals as well. So we lobbied, as Deborah explained, and we have more details on the Mapping Rare website. But also encourage you to look at the video on the Mapping Rare website, because that's the voice of the community telling you why it made such a huge difference. And it's really powerful when you hear people living with Fragile X syndrome in their own words say why it makes a difference to them.
That's great, Kirsten. And can you tell us a bit about how you determine the best steps to take? Because this is something that needed to be changed within the scientific community, right? So how did you approach that problem?
We were told it was impossible, that once a gene is named, you just can't change it. You know, it's set in stone. But we decided that we were going to try anyway. So we wrote a peer-reviewed article that was published in Cells, highlighting this issue and calling for a change. That did actually get an immediate response from the Hugo Gene Nomenclature Committee, who got in contact with us and said, we agree, we need to sort this. We had suggested alternate names in our article. They actually had their own ideas. So I would emphasize to listeners today that you need to be flexible. You know, we wanted it changed. Actually, we didn't mind what it was changed to as long as it was changed. So we listened to their point of view and their concerns. And what they wanted was to make sure the acronym was the same, because they already had 30 years of scientific research that used FMR1 and used FMRP. So they needed to find words that matched those letters so that they didn't have to go back and change 30 years worth of research articles. So they came up with the Fragile X messenger ribonucleoprotein gene, which is a very long name, but it stands for FMR1. So they could still, so they were happy, we were happy, and we started the process of actually having it changed online on their website, change on the UniProt protein database website, contacting all the databases around the world, letting them know. And this was in 2022. We're still having to work on this because it hasn't actually gotten into every country around the world. So the old nomenclature is still used, but it's a work in progress. The official databases have been changed. But yes, it's something we're still trying to work on to make even better. You're on mute, Deborah.
Thank you, Kirsten, for that summary. And now I'd like to turn to Sharifa Mbarak, who is the head of the Ali Kimara Rare Disease Foundation in Tanzania, and who's going to tell us about her achievement. She might be on mute. Let's just check. I'll just start explaining a bit that, oh, here she comes, I think. Great, thank you, Sharifa, for coming. So can you tell us a bit about the impact that being able to be homeschooled has had for Ali?
Hello, everyone. First of all, I sincerely apologize for my tardiness for today's meeting. Sorry, I'm still at work. Thank you so much. Happy Rare Disease Day, by the way, to all of you.
Thank you.
I hope everything went as we have planned. My name is Sharifa Mbarak, Ali Kimara's mother, child who's living with a rare disease from 2011. He's 2 years old, since when he was 2 years old, and also a founder of Ali Kimara Rare Disease Foundation and a chair as well. The foundation was named after him.
So he's been able now to be homeschooled, right?
Yes, yes, yes.
And so what has that meant for you as a family that he can be homeschooled now?
Well, we have started the homeschooling when he was at the age of 8. And actually, the system in Tanzania by that time did not allow any child to study from home. But we kept teachers for him. And when we started the awareness from 2016, we've been convincing and making campaign for that. But from 2020, the government registered him as the first child to study from home. And by in 2022, he had his national examination as the first child to study from home, and he did very well. We thank God. And in 2023, last year, the government launched a guideline for the whole country for other children to study from home as well.
Thank you very much. No, I think it's great to see that you've lobbied not just to have homeschooling for Ali, but for all children with rare diseases, so that you can have an impact at the national level. So thank you very much. And I encourage everybody to look also at the documentary that was made in Tanzania for Rare Disease Day, because that was very good. And to learn more about Ali's journey, there's a video of him on our Mapping Rare site. So thank you very much. I'm going to move on now to the next topic, which is equity through innovation. And on this topic, we have two, again, very different organizations, but that have both adopted innovative technology in order to help the rare disease community. And the first is the Wilhelm Foundation, which has brought together global minds and expertise at the world's first undiagnosed hackathon. And the second is CHARD in China, that is advancing patient care through a comprehensive cloud service platform. So I'll first introduce Helen Sederoth, who's the director of the Wilhelm Foundation. And could you tell us a bit about what the impact has been of the hackathon?
Yes, and thank you for having this event. I think it's wonderful. Wilhelm Foundation would highlight the meaning with the goal with this was to highlight that we can't solve all the undiagnosed diseases today. We can only solve 40%, and we would focus on these 60% and see how we could do with to help them solve the undiagnosed diseases, since it's important to get a diagnosis. And therefore, we thought that we have to do something new. And we said that we have to start to collaborate with all of the stakeholders and so. So we invited geneticists, bioinformatics, AI people, developer, and brilliant minds. And we told everyone that they can't have any titles. So no one should know what the other one beside them where they work with, to break the hierarchy. And we have participants from 95 countries, and they should try to solve undiagnosed diseases. And it was not just diseases. We had invited families from Sweden, and which had undiagnosed children, and 5 of them, 5 families. And then we also had participants from low and middle income countries. We didn't invite them because they were too sick to go to Sweden. And they started they had 2 days to try to find new ways to collaborate and new ways to solve these undiagnosed diseases. And yes.
Thank you very much for explaining that very exciting new venture. And now I'd like to turn to Sunny from Chart. Could you tell us a bit about how you determined the best technology to use in your platform, and how you collaborated with technology experts in creating this cloud-based platform?
The base on the platform, which is a patient management system for rare disease. First, I just briefly introduce this base. And since we would like to provide an integrated service, and with the efficient input, user-friendly interface, and assured security management, and standardized quality control, the base facilitates the communication between doctors and patients, as well as promotes the efficiency of patient management, as well as so as to help the doctors to make make appropriate treatment solution for the patients. I won't go into very details, because we in the system we kind of use the AI and also other kind of technology to make it more operate more efficient. Yeah.
That's great. And maybe I could...
okay. Sorry for the second. You said collaboration. I just missed it. Yeah, the collaboration. Actually, we worked with the hospitals nationally, a lot of hospitals, and also the expertise, the doctors and their teams. So currently, we have covered a lot of over like 140 teams of doctors from different hospitals. Yeah.
Great. Thank you very much for that. I think it might not be obvious to other groups how to take advantage of technologies, the latest technology. So maybe Hélène or Sunny, if you'd like to answer, what would you advise to other groups that want to take advantage of innovation and technology for rare diseases?
I think that this hackathon method could help so many other organizations, and to collaborate with so many specialists from all over the world. And since we have to do this we can do this even for drug development, and for finding new ways to whatever you are working with, since it was really successful to get all these together, all this.
That's great. Yes. Thank you so much. And I do encourage everybody as well to watch the videos that they've made of the hackathon, because you really get a sense of the project, and those are available on the Mapping Rare site. I'll now turn to the next topic, which is access, another way that we achieve equity. And for this, again, we have very different projects, but they both have the same goals in mind. The first is DEBRA International, which has put rare diseases on the humanitarian map in Ukraine by providing humanitarian aid to people with a rare skin disease. And then we have Casa dos Raros, which Roberto mentioned earlier in this webinar, which is the first comprehensive care center for rare diseases, which is really groundbreaking in Brazil, and I think also at the international level. So I'll first ask Liv, who is here from DEBRA International. I know it's probably hard to sum up the impact of this achievement, but if you had to choose just a few words, how would you describe the impact it's had on people in Ukraine?
Well, I think this achievement really was nothing short of a lifeline for many families. War would throw anyone's life into the greatest of turmoil, but living with a group of rare conditions that requires enduring medical care adds a significant extra mental load. And we had 120 families who were suddenly faced with the potential and actual loss of their home, their belongings, and life as they knew it, as well as the national support system that would usually provide their healthcare. So the support we were able to provide meant that patients and their families didn't have the additional burden of wondering how they were going to care for the medical needs of themselves or their children.
I think that one of the really interesting things here is that it was really patient-to-patient support. It was the DEBRA International helping other members of your community, and you talk about it as being one of your own and part of the family. And can you talk about why this kind of patient-to-patient support is so meaningful?
Well, especially for us, DEBRA groups are born from the mutual support of EB patients and their families. So a whole collection of people with vastly different backgrounds and experiences, but who all support and share the same cause. So we now have around 50 national DEBRA groups, majority governed by people affected by EB, functioning worldwide, supporting their local EB communities. So this is why we've always likened this growing network to an extended family. And DEBRA groups, EB patients and their families are truly awe-inspiring. And despite the great adversity they themselves face on a daily basis, there's no waning of their support for others. So the rapid response to DEBRA Ukraine's situation and the situation of their community was truly special for us.
Thank you. And I'd like to turn to Toni, Toni Daher from Casa Hunter in Brazil. And could you tell me could you describe the impact that Casa dos Raros has had on people living with rare diseases in Brazil?
Yes, thank you. Hello, everybody. It's an honor for me to be here with all of you and to share a little bit about Casa dos Raros. Today Casa dos Raros complete the first year of existence. The most important impact of Casa dos Raros is to reduce the time of diagnosis. Let me give you numbers. The average time to reach a diagnosis in the Brazilian health system is 5 years and 4 months. Our first data survey on Casa dos Raros reduced it to less than 60 days. We strongly believe that we are starting to change the rare disease history in our country with this model.
That's great. And you mentioned in your description that you really put the patient at the center of care at Casa dos Raros. And so could you tell me what that means for Casa dos Raros to be human-centered?
Yeah, Casa dos Raros was born from the perspective, the point of view of a caregiver and also the expertise of a great physician. I believe that makes all the difference. We construct protocols that are fully centered on the patient and his family. For example, all the cases are examined and discussed together by the multidisciplinary team. the single procedure avoids the loss of time, problems of communications, and also a lot of insights that are pretty common in a teamwork.
That's great. And I hope that Casa dos Raros can serve as a model for other countries. And so, yes, I encourage everyone to read more about it and learn more so that they can work towards this sort of human-centered patient care in other countries. Now I'd like to move on to equity through empowerment. So here we have two organizations that are really working to empower patient groups and patient advocates so that they can be very productive advocates for their own communities. The first is Beacon for Rare Diseases, which is based in the UK and has a program to engage and empower patient advocates. And the second is the Malaysian Rare Disorder Society, which has a number of different programs, but one is to combat stigma and raise awareness, and particularly focused on the youth population. So I'll first turn to Rick Stevens, who is the director of the Beacon for Rare Diseases group. And so at Beacon, you have a mix of in-person and online tools for empowering your members. And so could you tell us a bit about your resources hub and what the impact has been so far?
Yeah, for sure. It's really good to be here, guys. And I think a lot of the work we're doing at Beacon, as Deborah said, is all about trying to help patient groups be the best they can be and to connect with each other and learn from each other. And to do that, we've, for a number of years, trying to run training events that give patient groups the skills they need, whether it's in how to use social media, how to form an organization, or how to actually engage with the research world of rare diseases. And what we found, particularly through COVID, was a big move towards our online platforms. So we put together a new e-learning resource called the Resources Hub, which we launched about 18 months ago, which is really designed to hopefully provide a range of different tools, whether those are videos or online courses, to help patients learn the things they want to learn. And to help them be, as I say, the most effective advocates they can be for their given rare disease. So we've now got over 300 registered users on this platform, which is really exciting. And we've been working quite hard in the last few years and months to make this more accessible, more engaging, and hopefully to ensure that content really reaches beyond the UK to people around the world where possible.
And do you have any advice that you would give to other groups that were creating materials, resources that are really accessible to make sure that they're accessible to all of their members?
Yeah, it's a real challenge, actually, because there's some very technical information you have to get involved with in the world of rare diseases about the science. So we've thought a lot about how we're trying to communicate the complex ideas around the scientific side of rare diseases and tried to use certain tools available to get that reading age really good. But we're also thinking about the accessibility of the platform itself. We're trying to have media that people can learn from written things, audio things, visual things, videos wherever possible. And we've used a platform called ReachDeck on the website, which hopefully means that we can serve lots of different accessibility needs, which are really prevalent in the rare disease community, but also that allows some translation to make sure that the resources and training we're putting out there can reach people in different languages in different countries, so not just English. So love to hear your thoughts on how successful that's been.
Thank you very much for that, Rick. And now I'll turn to Nadia Hanim Abdul Latif, who is the Executive Director of the Malaysian Rare Disorder Society. And I'd like you to tell us a bit about your programs for youth and why you've chosen to focus on youth empowerment.
Thanks for that, Deborah. Happy World Rare Disease Day, everyone. I hope everybody is well wherever you're at. So for context, there's approximately 15 million youths in Malaysia. That's almost half of the population of the country. And in Southeast Asia, the youth population is actually increasing. With that, despite the fact that Malaysia doesn't have an official national registry, we are seeing a lot of our patients, irrespective of whether there is a cure or not to the rare diseases that they have, who are moving steadily into adolescence and youth. And like what was rightly pointed out by Rick earlier, the COVID pandemic was really a huge eye-opener and equalizer for a lot of the families and a lot of people who overnight became either very isolated or became very comfortable with their isolation. So we started the issue of what was actually immediate for us. When the pandemic happened, there was a lot of stigma to persons living with rare disease internationally, with people saying that, you know, we're a product of the vaccines, we're a product of the movement control order. So we've done several different things that we've started even before the pandemic, ranging from awareness raising, talks on sexual reproductive health among the youth themselves, combating stigma, talking about limiting belief. We have, similar to what Willem Foundation has, we have what we call the Shark Tank that looks at building entrepreneurial skills. But this year, what we're most excited about is we have partnered with the Ministry of Youth, and we've launched this campaign called Don't Just Stare, Say Hello, where we're combating the idea of stigma head on through social media together with the Ministry of Health and all of the other ministries combined. And you'll probably see that on our social media right now.
Thank you so much for that, Nadia. And now I'd like to introduce projects that are focused on collaborations between rare disease groups and other communities, including the scientific community. And so here we have three groups that are focused on ultra-rare diseases, and they've all managed to accomplish great things in terms of collaboration. First, we have NCBRS, which has set up a scientific advisory board. We also have SKDAS, which has developed assessment tools collaboratively with a researcher. And then we have INPDA, which has created an international disease registry that was really established by their community for the community. I'm going to start off again with a video because we have Kyle Hillman, who is the CEO of SKDAS, who couldn't join us today.
Hi, I'm Kyle with the Skraban-Deardorff Syndrome Foundation. Our project is the Neurobehavioral Evaluation Tool, and this project has the potential to significantly impact our community by providing an entirely new measure for tracking thinking skills and behavior. This project is unique in that we can track eye movements simply using a webcam. A series of questions, prompts, and instructions are provided, and the participant identifies and indicates their response simply by looking at the screen. The program then determines and validates the correctness, time, and processing of the response. Especially important is that many of our SCDish children have great receptive language, but oftentimes difficulties with expressive language exists. Overall, we're equipping clinical specialists and researchers with better tools to understand the condition. What this will accomplish is improving diagnostic and intervention strategies. And if all goes well, this application can extend beyond just a diagnosis of Skraban-Deardorff syndrome. When we think about collaboration between the organization and clinicians and researchers, the importance of collaboration is paramount. Oftentimes, clinicians and researchers know the knowledge of the syndrome from an academic standpoint, but it's the parents and the caregivers that know the person behind the syndrome. We complement each other extremely well and are able to get a holistic view of the child that works mutually in both of our favors. We're also fortunate in that our lead researcher is the parent of a child diagnosed with Skraban-Deardorff syndrome. If there's a lesson to be learned from this project that I could pass on, it's plan for the unplanned. If a delay might happen, a delay is going to happen. Build in and account for your roadblocks, but don't get discouraged by them. Genetics and research are marathons. Keep focus on the greater goal, and the small hurdles will seem inconsequential. And looking at the amount of resources we have versus some larger organizations, the best advice I can give is to keep your passion fueled. For me and for a lot of parents, our beacons of why we're doing this is always right in front of us. It's our children. I consider myself fortunate to have this driving force in front of me daily. My son is my reason for the late nights and the early mornings, getting in the foundation work when I can. The other advice I have is it only takes one small action. For us, a group of parents wanted more out of this condition. So we formed a nonprofit about 18 months ago, focused on research and awareness. And today, looking back, we are light years ahead of where we thought we would be. But it all started with an idea. With that, I wish you all the best of luck, and thank you.
All right. So now I'll turn to our panelists who are here today. So first, Nuala from the Nicholas Barrister Foundation, could you tell us a bit about what the impact has been of setting up this scientific advisory board, or what you expect it to be?
Yeah, sure. So, this is something that since we set up the foundation, we really wanted to promote this and set this up, because there's not a huge amount of research out there on NCBRS, with it being an ultra-rare condition, and some of the publications are quite dated. So we needed to, make sure that there's more research going on to give treatment options, looking at care plans for our patients, and not even treating the whole condition, but even being able to kind of give advice on treatment of particular elements of it, let's say epilepsy. So this is really important for us to set this up as a kind of a milestone, to really put more focus on the research end of things for NCBRS.
Great, thank you for that. Maybe Jim, would you like to also tell us about what the impact has been of establishing this registry for Niemann-Pick? Jim, I think you're muted.
Hello, the International Niemann-Pick Disease Registry is a professional registry that's been set up by the community for the community, as you said. When you think about a rare disease, you have to realize that with an ultra-rare disease, or any rare disease, everything is rare. So the patients are rare, the clinicians are rare, the researchers are rare, and the pharma companies who might be interested are rare too. Can you hear me?
Yes.
Yes.
Sorry, it just says unmute. So, our problem was really how to tackle that. And over the years, patient communities were formed. The patient communities formed into an international alliance, bringing together not only patients, but the researchers in their different countries, in order to maximize the use of resources, because resources are rare as well. So it was with an object really of understanding, increasing the understanding and the knowledge, improving, the way we understand the progress of these diseases and natural histories, so that we could begin to make a difference. So it was really based on making a difference. The International Registry now forms, if you like, the ultimate example of collaboration, because it's brought together patients, families, the clinicians, the researchers, and also now the pharmaceutical companies, of which we have 5 or 6 who are now working with this disease. This has huge potential, I believe, and we believe going forward. And if you think about it in an international sense, wouldn't it be a wonderful world if all rare diseases could have an international registry, so that we could begin to understand the frequency, the development, the knowledge, and share it? And that would be our hope. And we're hoping that we can do that with our registry. Thank you.
Thank you, Jim. And this question, I think, is for both you and Nuala. Is there anything that you would do differently if you were setting up a similar project, or any lessons learned that you'd like to share with other ultra-rare groups or regular rare disease groups that might want to do something similar?
Well, I'll start.
Okay.
I think you have to have right at the heart of everything you do always the belief, the basic principles of why you set this up. It's very easy with any project on the way along, because of the number of conflicting interests, to be diverted. And when you get into that position, always go back to your basic principles. Why are you doing this? And is it making a difference to progress through collaboration?
Thank you. Is there anything you'd like to add, Nuala?
Yeah, I mean, I think in terms of lessons learned, I think it's, you know, don't be afraid to kind of use, you know, other things that are already going on. There's a network out there. There's lots of other people who have done similar things. So don't reinvent the wheel all the time, but look at what's very specific to what you need to do. So I think in terms of setting up our board, we were very aware of the collaborations that we needed. So we wanted to get a good mix of people on the board, you know, so clinicians. We were very lucky to have Dr. Nicolaitis, who's one of the people whose condition was named after, as a clinician coming onto the board, but having also people from academic organizations, having patient representatives as well, so that, you know, I suppose we can always make sure that the focus of the research is going to be that will benefit patients. So I think it's just that lesson to make sure that you are kind of planning ahead what your collaborations are going to need to be, and therefore having those people on the board. And I want to say thanks as well to Beacon, because I know Lee, our CEO, has a mentorship program through there, and that was a big help in terms of making sure we weren't reinventing the wheel and really learning from others in the way we plotted this out, because it does take a lot of time and effort, and you want to be as efficient as possible in what you're doing. So yeah.
That's great. I think those are very wise words, and that's something that we really want to reinforce here at Rare Diseases International, that we're here also to serve as a resource to connect you with other organizations that are doing something similar. And I think it's important for all of our organizations to be able to learn from each other, because a lot of you have achieved these great things, and others may want to do something similar. So I really encourage everybody to discuss.
And we're happy to share any of our processes or documents with anyone else who wants to set up a board. So we're quite happy to do that, because, you know, we've had that benefit from others. So pass it on.
So I'd now like to go to the Q&A section. I see that there's a few questions that have been directed towards Helen from the Wilhelm Foundation. So maybe we could ask you, Helen, to speak to us. Could you tell us a bit about the results of this hackathon? Were there diagnoses that came from it, and did it meet your expectations?
Yes, it was 4 families got a diagnosis on their child, on their children. And thanks to that, we did long reads RNA and long reads whole genome sequencing, and then they could find these diseases. And but we also were looking for broader perspective. We would like to find new ways for all of this, not only for the 13s we worked with, but we didn't succeed with that. And we hope that for next hackathon we can look more at how we can do it broader and how we can figure out new ways to solve these diseases. But it was 13, last year we had 13 undiagnosed children and adults, but this year we will have 35, I think. So we have a lot of patients, and we will do new. And it also shows that we have to do more, that we can't stop diagnose them if we can't find anything with whole genome, whole exome sequencing. We have to go further. We have to take new, as for this year, we will also include optic genome mapping to see if that can help something. And so we have to never stop, never end the diagnostic. There is hope outside, and it will come, hope for all of them.
Great, thank you for that. I want to encourage everybody in the audience to ask any questions that you have in the Q&A section. That's the easiest way. And we're also able to unmute some of you who'd like to ask your question verbally. I see one question in the chat, which is about the National Disease Registry. and your experience interacting with clinicians. I guess that's for you, Jim. Have you encountered any resistance in releasing data, and how have you overcome that?
Not resistance from the clinicians, only in terms of the amount of time clinicians have to do these registries. I think one of the things that we have discovered is that without a national registry, a single national registry, if you get two or three pharmaceutical companies who are interested in a rare disease, and all of those companies need registries, then the demands on clinicians increases. And so having a single registry can be a selling point to clinicians. You know, if you say there's only one registry for this disease, and even if you have, 10 companies working on it, if they could all be using the one registry, then that would make a huge difference in terms of wasted resources. So with regard to the actual clinicians, it is difficult. I wouldn't move away from that, having clinicians find the time, but I don't find a resistance to the concept of a single registry.
There was Did you have something to add, Jim?
Well, I was just seeing Roberto on the panel there. Roberto, has a lot of experience in this, and I know is contributing. He may have a view on this one. I'm sure he does.
Would you like to add anything?
Well, I think this is a great initiative. It is an innovative way to conduct a registry, and I'm sure that we will have a lot of information that is not usually captured by the standard disease registries we have. So I think really that this will maybe game-changing in terms of patient registries for rare disease.
Just to add one point, one of the things that happened under the existing system, if you had 4 or 5 registries and a lot of patient data had been collected, getting access to it by other members of the community was not always easy, if at all possible. And it was held, and yet it was patient data, and that was a big challenge. And that's another one that we hope to be able to overcome, so that you can get publications based on the registry coming out to support all developments and potential therapies. You never quite know where the knowledge is going to come from. You just have to collect it, and then let's have a look at it. But you've got to be able to look at it. That's the point, really.
Thank you for that. I have a question from Trisha Fontamilis. I've turned on your microphone. Okay. Would you like to unmute, Trisha? Perhaps she's still loading her mic there. Well, while we're waiting for that to work, there was another question about collaboration, and it was directed to Kirsten Johnson of the Fragile X Foundation, Fragile X International, and it was whether you're still in contact with the clinicians involved with Fragile X research. Would you like to talk a bit about your collaboration with the scientific community?
Yes, so Fragile X International is a global umbrella organization of lots of country family organizations, and many of them have scientific boards. And Fragile X International, one of the first things we did when we became an international registered organization was set up our own scientific board, because we believe having that knowledge base and those connections with scientists really does make a difference. We've already published 3 articles in collaboration with different scientists, and we have a 4th one that's in the works that's just been submitted last week. So we believe peer-reviewed articles are the way forward, because if you can sort of get scientific oomph behind what is patient experience, then that actually makes things happen. So we've used that as a route to affecting change. One thing that we didn't put on Mapping Rare, but we could have equally done, was that what's becoming more common with Fragile X is genetic carrier issues. So people like myself who carry a premutation of the gene and have given Fragile X syndrome to my child, we also have a group of conditions that actually could affect us. And there needs to be more research in that, but it's now been identified by the Fragile X community, and they now have an international premutation conference that happens every 2 years. And so we as a community didn't want to be stigmatized in the same way as our children were. And we published an article calling for those groups of conditions to be called Fragile X premutation associated conditions, which was a nice umbrella, non-offensive, inclusive term. And indeed, just this last year, it was adopted by the scientific community. It took us 2 years of lobbying for them to listen to us, but we now have something that we're willing to own ourselves when we go along to our GP and said, can you, look at me as the mum and see if any of these things are affecting me? So our advocacy continues, but in answer to your question, Deborah, working closely with scientists and researchers and clinicians has been key to all the change we've managed to affect.
Thank you so much for that, Kirsten. Well, that's all that we have time for today. So I want to thank all of our speakers and our panelists for taking the time to be with us today, and everyone who's attended the webinar and who's watched on Facebook Live as well. I'd like to encourage everyone to visit the Mapping Rare website. You can access it from the Rare Diseases International website homepage. And so please share that with others, both in the rare disease community and beyond, because this is really an opportunity for others to learn more about rare diseases. And I just want to remind everyone that this first group of participants is just the beginning of Mapping Rare. We're really hoping that this will be a living project that we can add to, and even the participants that have already submitted something will be able to add further achievements and updates. And so we'll be holding a call for more submissions shortly. So we hope eventually to be able to populate this map with achievements from all of our members. So thank you again, everybody, and we hope to see you again soon.
And the last word, I would like to congratulate the RDI team for Mapping Rare launch and for this webinar. And I thank you, all of you. Happy Rare Disease Day.
Thank you.